Dr. Al Maria. I was a infectious disease physician and a public health physician and medical epidemiologist for the last 30 years, and I've been involved with the Public Health Museum basically since as an advisor before it opened, and then for the past 15 years on the board of the museum. The Public Health Museum was the dream of some very far-sighted public health heroes in Massachusetts: Chester Kennedy, Helen Meltzer, Carolyn Garrick, who, partnering with M.J. Marcucci here at Tewksbury Hospital, saw the need for a public health museum because the general public, people don't really know the story of public health and what public health has done and is doing to protect the health of the population. So the Public Health Museum really serves to maintain and preserve the history of public health, the documentation of that history, as well as exhibits that exemplify some of the great successes of public health. We've acquired what we have at the museum in basically two ways. There was a foundational, original exhibits at the museum, and those were built on a variety of collections that people had made since the first conception of a museum back in 1969. So they knew that someday they wanted to have a museum, so they started to collect materials. For example, the iron lung, which is a major part of our exhibit, comes from Lakeville Hospital, a hospital that closed in 1991. So as the hospital closed, material that might be of relevance to telling the story of public health became available. And then since that time, we've still depended on people identifying materials that might be relevant to the public health story. Our dental exhibit, for example, was primarily contributed to by Chester Douglas, who was a sort of a famous figure in public health dentistry. Some of the material we have in our nurses area is from the School Nurse Association, the Massachusetts School Nurse Organization, that was very interested in highlighting in 2005 the 100th anniversary of school nursing in Massachusetts. Why Outbreak started was because we recognized about 7, 8 years ago that the public really didn't get the public health story. There was very little understanding of what public health does among the public. So what we thought was, why not start early? Why not start with high school students, take high school students and teach them about public health.
I think the Outbreak program is a really cool idea. I think it is doing a really good job introducing me to fields in healthcare. I didn't really necessarily know exactly what public health was, but I learned that they typically work more towards finding a solution for the problem rather than just finding a solution for the symptoms of the problem. So what I mean by that is, so rather than just maybe treating like illness or sickness, they're looking, why are people getting sick? So maybe it might be like the water supply or socioeconomic factors and stuff like that.
I have a really strong interest in the medical field, and at my school I'm involved with the Medical Reserve Corps of Natick, specifically the Junior Medical Reserve Corps. One of my mentors recommended this program because of my interest in the public health field, and I think it's really awesome that it was an opportunity to inspire the younger generation to get into a field of public health. I would highly recommend it, and I think it's a super cool way to get involved, especially as a high school student.
Another feature that the Public Health Museum has now are walking tours of the Tewksbury Hospital campus, which historically and architecturally is of great interest. The museum really depends on its volunteers, and we have a cadre of very dedicated volunteers now who staff the museum and provide tours. If you have time, if you have children in school during the day and would like to volunteer, or if you're retired and have time to volunteer, we can find some very rewarding work for you to do to help spread the word about public health as well as to preserve the materials in the Public Health Museum. So contact the Public Health Museum. We're always looking for volunteers.